is Lindsay Ferguson. I'm an occupational therapist. I'm a member of the American Organization of Occupational Therapy, as well as the Illinois Occupational Therapy Association. And today I would like to tell everybody how I believe in national health care and that everybody needs health care insurance, not only because it's part of my profession, but also because I've been touched personally by people in my life who've needed health care. So part of being an occupational therapist is advocating for our clients, promoting independence and empowerment. It's really important to as an occupational therapist, to incorporate prevention and promote health and well-being for our clients. On a personal level, I believe in the need for national health care because one of my very, very good friends just recently passed away from colon cancer, which is a completely preventable form of cancer, because he was never, I guess he was never lucky enough to get the access and quality of healthcare that he needed. My friend was diagnosed as a child with the wrong diagnosis, which was basically he developed all these lumps all over his body, and when he went to the doctor, he got basically a diagnosis of that this is just something that's benign, nothing to worry about in the future, and so he went through his life. He became a construction worker. He never could afford healthcare by himself, and it turned out that the disease that he was diagnosed with when he was a child was not actually benign, and it actually needed to be followed up with routine screenings, and it turned out that all the lumps all over his body were guaranteed to become cancerous. It's like a 1 in a million people get this disease. So he needed to be checked regularly, and the lumps that were forming in his colon actually turned out to be cancerous. When he started to feel bad with cancer, he went into the to the doctor. He waited a long time because he didn't have health care. They gave him different diets to try, never ordered him a scan of any kind. And when he finally went back to the doctor, because he was paying out of pocket, when he finally went back to the doctor, it already spread to most of his body. So because he did not have access to health care and he didn't have insurance, he was not able to get the scans and the treatments that he needed in order to prevent this disease. So my friend died last year at the age of 25 years old from a cancer that's 95% treatable if it's caught early, and if it's not, then it's basically your survival rate is 5% after it's metastasized. So it really strikes a chord with me because my mom had the same cancer, and because she had healthcare, because she had a routine pap smear, they were able to diagnose us. I guess she's here today because of it. And the fact that my neighbor, who I love dearly, my friend, died from this cancer that completely preventable is just not right. So as a professional that helps people achieve independence and be as healthy as possible, and as a daughter and a friend of somebody who had a cancer, I urge everybody to support national health care because we're all worth it. It's humanity. It's what needs to be done.